Hello everybody, my name is Elena Ateva and I'm the Maternal and Newborn Health Policy and Advocacy Advisor at the White Ribbon Alliance. Welcome to the webinar Utilizing UN Human Rights Mechanisms for Respectful Maternity Care. First, a few housekeeping items. Before we begin today's webinar, we will be muting participants and we ask you to submit questions in the chat box on the right-hand side of your screen. We have plenty of time for questions and answers, and we welcome your questions as they come in. Please note that there might be a little delay in advancing the slides, so there might be a little delay between the slides and the presentation, so keep that in mind. Today's webinar is presented by the Advocacy Subcommittee of the Respectful Maternity Care Council. The Council is a multidisciplinary group of more than 100 organizations representing 300 members from around the world, including researchers, clinicians, advocates, professional associations, non-governmental organizations, UN agencies, and donors. The Council is dedicated to identifying, implementing, and advocating for strategies to promote respectful maternity care, tackle the problem of disrespect and abuse during childbirth, and ultimately improve the quality of reproductive, maternal, and newborn health care. The goal of this webinar is to introduce you to human rights mechanisms within the United Nations system, which you can use for advocacy for respectful maternity care. The term respectful maternity care comes from our common understanding that safe motherhood extends beyond the prevention of death and disability. It is respect for every person's humanity, feelings, choices, and preferences in childbirth. RMC, as we tend to abbreviate it, has also come to mean a set of rights which are due to every woman and every baby in maternity care. The RMC charter that you see on the screen was developed by the Global RMC Council in 2011. It is based on universally recognized human rights instruments to which many, if not all countries, are signatories, as for example, the International Covenant on Civil and Political Rights, the International Covenant on Economic, Social, and Cultural Rights, and the Convention on the Elimination of All Forms of Discrimination Against Women. In the RMC Charter, you can see the multiple rights that apply in maternity setting for the protection of the users of the system, women and their families, as well as the providers. The human rights-based approach of respectful maternity care looks at the systemic issues that plague maternity care systems around the world. I would like now to introduce you to our speakers this morning, starting on your apologies. We're just trying to remove the chat box screen so you can see the whole. Okay. Yeah. All right. First speaking, we have Ruben Brouwer, an associate expert in human rights from the Office of the High Commissioner for Human Rights, the section on women's rights and gender. He will be sitting in for Lucinda O'Hanlon, who was not able to join us this morning, but hopefully she'll join us later for the Q&A session. Ruben works on sexual and reproductive health and rights, women's human rights defenders, and political participation more generally, and conflict-related sexual violence. Previously, he worked for GIZ in Ghana, Human Rights Watch, the Netherlands Mission to the UN in New York, Search for Common Ground in Tanzania, and Peace One Day in the DRC and the UK. Ruben will give us an overview of the different human rights mechanisms that are available for our advocacy needs. Our second speaker, Daniela Drandic, is head of the Reproductive Rights Program at RODA-Parents in Action in Croatia. Ms. Drandic has been head of the Reproductive Rights Program since 2012. Several years ago, while pregnant, she was forcibly hospitalized against her will and given a cesarean section that she did not need, because the attending physician told her that women at term do not have legal agency to make decisions about their health care. After this experience, Daniela decided to dedicate herself to improving the maternity care system in Croatia and she helps to lead RODA as it provides evidence-based maternity care resources and advocates for women to speak up for their own rights in maternity care. Daniela has participated in CEHURD shadow reporting and in a recent visit of the UN Special Rapporteur for the Right to Health. Our third speaker is Noor NakibuukaMusisi. She's a program manager of community empowerment at the Center for Health, Human Rights and Development, or CEHURD, in Uganda. Ms. Musisi has extensive experience working at the community level to identify health problems and find local solutions. She currently coordinates a group of 45 community health advocates from 3 districts in Uganda to advocate on behalf of the voiceless for health and human rights. Ms. Musisi holds a master's degree in law where she studied the efficacy of public interest litigation in realizing maternal health rights in Uganda. She has also contributed extensively to research on health rights-related court cases ranging in focus from maternal health, access to information, women's right to access emergency obstetric care, mental health rights, and the right to clean and healthy environment. She will focus on CEHURD's experience with the Covenant on Economic, Social, and Cultural Rights. Our fourth speaker, María Moreno de los Ríos, is a founding partner of El Parto Nuestro in Ecuador. María was the national coordinator of the organization from 2012 to 2016. She's currently responsible for obstetric violence in Ecuador and coordinator of the CEHURD International Working Group. She's a member of the Coalition of Women of Ecuador and the CEHURD Platform of Spain. María currently conducts research on obstetric violence in public health centers in Quito. In the past, she has worked on projects with Afro-Ecuadorian midwives and against gender violence, and she will be presenting on her experience with the CEHURD shadow reporting. I would like to thank all speakers and all of you for participating in this session, and I would like now to turn it over to Ruben Brouwer from the Office of the High Commissioner to give us an overview of the different mechanisms that are available to us.
Thank you, Elena, and thank you everyone on the webinar. It's a great opportunity for OHCHR to participate in this important webinar and to engage with you about the international human rights mechanisms, and also, of course, to learn from your experiences from the fellow presenters, some of whom I have the privilege of knowing very well. As well as in the Q&A after the session. I've been asked to provide an overview of the UN mechanisms in 15 minutes, and I must admit that this is quite a challenge, but I'll do my best. But that being said, what I will be describing to you will be a surface level, and there will be much more in-depth information available in some of the documents that I also provided Elena, which I hope can be shared with you as well. But on that note, my presentation will focus on the international human rights mechanisms that you can engage with as civil society actors, and also how you can engage with them as part particularly of your overall change strategy, your overall strategy at advancing sexual and reproductive health and rights issues in your local or national contexts. I'll touch on treaty bodies, but I'll also touch on the political bodies established by the Human Rights Council at the UN, the special procedures, and the Universal Periodic Review. I'll leave the specific examples of various cases and such to my fellow presenters, who I understand have some great examples to share. Next slide. So virtually every type of UN human rights mechanism follows a similar process of collecting information and receiving information from states, but also from civil society actors like yourselves and other actors, then sitting with the government, sharing concerns, making recommendations, and monitoring the outcome of these dialogues. And this is sort of the general information and process flow of human rights mechanisms. Next slide. So I'll begin with treaty bodies. For those of you who are not familiar with treaty bodies and treaties, treaty bodies are bodies of experts which are established with each of the 9 core international human rights treaties. Think, for example, of, and Elena mentioned a few already, the International Covenant on Civil and Political Rights, for which we have the Human Rights Committee, which monitors that treaty. You have the International Covenant on Economic, Social, and Cultural Rights, and you have the Committee on Economic, Social, and Cultural Rights. You have the Convention on the Elimination of All Forms of Discrimination Against Women, and you have the Committee on the Elimination of Discrimination Against Women, and the Convention on the Rights of the Child, and the Committee on the Rights of the Child. These are just some of the examples, but these are, for example, the key bodies and treaties with which we work on issues of sexual and reproductive health and rights, but not the only ones. The other ones are also relevant in certain contexts. And for way of background, when a state, when a country ratifies an international human rights treaty, that state is required to give effect to the rights that are enshrined within those treaties within their jurisdictions. And treaty bodies provide the expertise and the interpretative guidance to help states to do so. So next slide. So how do they do this? So treaty bodies have a number of main functions. I'll mention 3 of the functions that are really relevant for our work. The first is to monitor the implementation of treaties, either through the examination of periodic reports by state parties. States, when they ratify a treaty, they have an obligation to provide periodic reports on how it is that they are implementing their human rights obligations. And these reports are reviewed by the treaty bodies, which then makes recommendations which are public in the form of concluding observations. That's what they're called, concluding observations, and those recommendations are found there. Then we have the examination of individual complaints as well and communications. So individual cases can come to the attention of treaty bodies. Then we have inquiries into specific human rights situations that treaty bodies can undertake. This is in cases when there are serious, grave, or systematic human rights violations taking place in a particular country. Now, the second function of a treaty body is to provide normative interpretation and clarification of treaties and the obligations enshrined in treaties. This is done through what we call general comments and statements, or general recommendations in the case of CEDAW. For some reason, CEDAW has a different name for the same thing, so they're actually the same things. Then as a third function, the cooperation with UN organs and organizations, as well as with civil society organizations like yourselves. Next slide. So how can civil society organizations like yourselves engage with the treaty bodies? You can promote adoption of new treaties and the ratification of existing treaties. You can check, for example, on OHCHR.org whether a state, your state, the state that you're working in, has ratified a specific treaty or not ratified a specific treaty, so that you can then see whether there is a need for promoting the adoption or the ratification of such treaties, and also, of course, to understand what obligations your state has. Then you can also monitor the reporting obligations of state parties. So when a state has ratified a treaty, are they actually reporting to the treaty body on how they've been implementing the treaty? And when they do, what is it that they're reporting on? Perhaps, and in most cases this is the case, they provide a very pretty picture of the situation on the ground in relation, for example, to sexual and reproductive health and rights. But there are things that are not mentioned by the state, which is then something that civil society organizations can complement by submitting written information, the third point on the slide. And this can be done through various means, but the most common method that civil society organizations use is through civil shadow reports, to provide an alternative report to the report provided by the state party. So it follows along the same points that the state party mentions, but it actually either agrees or refutes some of the claims that the state is making in its report and provides the additional information that's required to make that assessment. Then you can also, as a civil society actor, contribute and attend or view sessions and meetings by the treaty bodies. Mostly these take place in Geneva or the general Geneva mostly, but also online. Sometimes there are public sessions which you can view online as well. Then you can also follow up to recommendations, and this is one of the key features that civil society actors can engage in. Treaty bodies have oftentimes already made recommendations on your country in the past, which you can look up and you can use in your advocacy on promoting and advancing SRHR standards. And also when they come out in the future, these are recommendations that you can also use to put pressure on the government or to indicate to the government that they are under an international legal obligation to give effect to those recommendations. Then you can also submit individual complaints. I mentioned this before as one of the features, one of the main functions of the treaty bodies. There are specific requirements for individual complaints. It requires, for example, the exhaustion of local legal remedies, which means that you would have had to have gone through the local legal system all the way to the highest court before you can actually access this part of the mechanism in order before you can go to the treaty body. So this is there are certain specific requirements that you must adhere to before you can engage in individual complaints. And then there is the provision of information for what we call confidential inquiry procedures or urgent action procedures, which the treaty body can undertake as well. So this is some of the elements that civil society organizations can engage in with treaty bodies. Next, please. Next slide. So we discussed treaty bodies, and it's now time to discuss special procedures. Special procedures are mechanisms to examine, to monitor, to advise, to report on human rights issues or on country situations, so human rights situations in a country. They're either individuals, such as special rapporteurs, they're called, or independent experts, or they're groups of individuals, and these are often called working groups. They are split into 41 thematic mandates and 14 country mandates. And when we speak of thematic mandates, it really focuses, the special rapporteur really, or the special procedure, sorry, really focuses on an issue or a specific group. Think, for example, of the special rapporteur on human rights defenders, the special rapporteur on health, the special rapporteur on torture, the special rapporteur on violence against women, the working group on discrimination against women in law and in practice. These are some key examples in relation to sexual and reproductive health and rights. And then there are 14 country mandates which focus really specifically on the human rights situation in a particular country. Now these mechanisms are established by the Human Rights Council through a resolution at the Human Rights Council, which also defines the mandate of the special procedure body. However, they are independent experts and unpaid experts. So it's also good to be aware of that. Next slide, please. So the main functions of special procedures, I'll mention 4 is, so I start with the country visits that they conduct, usually 2 to 3 times a year, depending on the mechanism in question. This includes meeting with civil society actors like yourselves, as well as states and other actors, engaging in a press conference at the end of a country mission, reporting, and it also includes a report to the Human Rights Council after a country visit is concluded with recommendations. What's important to note, though, with the country visits is that it does require state cooperation and an invitation to visit the country to look at a specific human rights issue. The second is communications, and these are sent primarily to the state on cases concerning individuals or groups, or on general or human rights trends in a country. These can be in the form of a letter of allegation from the special procedure towards the state, for example, on human rights violations that have allegedly already taken place. But they can also go in the form of urgent appeals, which are more for human rights violations that are still occurring or have a high risk or chance of occurring and therefore need to be urgently addressed. The third function is annual thematic reports, both to the Human Rights Council as well as the UN General Assembly, and the interactive dialogue that follows the presentation of such reports. A good example of such a report is the report by the Special Rapporteur on Health last year on adolescent health, which also includes a particular section on sexual and reproductive health and rights. As we know, this is an issue which disproportionately affects adolescents. And then there is the Special Rapporteur on Persons with Disabilities, which this year is producing a thematic report, and it's still ongoing in its research on sexual reproductive health and rights for persons with disabilities. So that's another example on that. Then the fourth, awareness raising through media statements, through press releases, for example, or participation in conferences is another area in which the special procedure can engage. Next slide, please. So how can civil society organizations engage with special procedures bodies? Well, you can submit individual cases for communications by special procedures. You can provide information and analysis on specific human rights concerns that are in your country or in your local contexts. You can provide support to special procedures for country visits, for example, by lobbying governments, your government, to invite a special procedure. If your government is saying there are no human rights issues or there's no issue around sexual and reproductive health in our country, then why would they have an objection to invite a special procedure body to look at that specific issue? But you can also use a visit to build momentum around the issues that you are working on, including by meeting the special procedure, by raising awareness of the issue through the media, because the media attention is usually there as well when the special procedure body visits a country. And you can also use the opportunity to build new partnerships, including with individuals or bodies within the government. You can also work locally or nationally to advocate, disseminate, follow up the work of special procedures and the recommendations they have made. And you can invite special procedures mandate holders to participate in any initiatives that you are engaging in. Lastly, you can also nominate candidates for consideration as special procedures mandate holders. Think, for example, of the Working Group on Discrimination Against Women, which is currently just released a call for nominations to replace 4 new members in that working group. So if you are aware of any experts in this area, this is an opportunity to also provide and nominate candidates for consideration for that. Next slide, please. So we've spoken about treaty bodies, we've spoken about special procedures, and now it's time to talk about the Universal Periodic Review. Next slide, please. So what is the Universal Periodic Review? It's a unique process of review of the human rights record of all UN member states. It is a universal process. Every UN member state gets reviewed. It's a periodic review, which means that every 4.5 years, every state gets reviewed once. And it's reviewed by UN member states, not, for example, by independent experts, as is the case with special procedures, or with experts of the treaty bodies, but it's actually reviewed by UN member states. Now, this review is based on 3 reports: the state report, a UN compilation report, and the stakeholders report, which includes civil society and national human rights institutions. The outcome of this process is a set of recommendations to the state concerned, which the state can then decide to either accept or to note. And by noting, it usually means that they do not accept the recommendation. But when a state does accept a recommendation, this is an opportunity, again, for civil society organizations to follow up on. Next slide, please. So indeed, how can civil society organizations engage with the Universal Periodic Review? Before the Universal Periodic Review actually takes place, you can participate in a national consultation for the state report. The state report is supposed to be formulated after national consultations, including with civil society actors. You can also submit information to us, to OHCHR, to the Office of the High Commissioner for Human Rights, for the stakeholders report, and you can contact embassies in your country to advocate at the Universal Periodic Review to raise issues that are of concern, like sexual reproductive health and rights issues that are of particular concern in your country context. Now, during the UPR session, you can lobby states to raise issues during the review, as they are the only ones that can in the formal process. You can also lobby the Troika and the working group to ensure documents reflect key concerns raised during the review. Now, the Troika and the working group is 47 Human Rights Council states, chaired by the Human Rights Council President, and the Troika are 3 states that function as rapporteurs, which basically facilitate the review and prepare the report of the working group. Now, after the UPR session, there is a time between the UPR session and the adoption of the report by the Human Rights Council in which you can lobby your government to accept the recommendations that were made at the UPR session. And then you can also develop strategies, including the media, including campaigns, including bilateral discussions with the government to implement the recommendations of the UPR. Next slide, please. Now, lastly, I wanted to show you a comparison chart, which I won't go into detail with, but just to leave that with you. And I hope that you will also receive a copy of the slides, but this is just to give you an overview of the differences between the different international mechanisms. It's important to note that the mechanisms are not exclusive, so using one does not necessarily mean that you cannot use the other mechanism, and it's important to note that they often reinforce each other. So the UPR process often leans a lot on what kind of recommendations have come out of the treaty bodies and the special procedures bodies, for example. The special procedures mechanisms, the special procedures mechanisms, the treaty bodies, and the UPR are also there to be used by you to further advance sexual reproductive health and rights issues in your own contexts. But that engagement does take time. It does take an investment. It does take persistence and stamina, and results are not always immediate. However, there is the potential of a big impact, and it is another key tool that you can use in your own advocacy at the national level to advance sexual reproductive health and rights and respectful maternal care as part of that, of course. But I'll leave it to the other presenters, which have concrete examples of how these mechanisms have had that impact. So thank you very much for your attention. I hope this was helpful, but of course we still have the Q&A at the end of the session. I'm happy to answer any questions as well. Thank you.
Thank you, Ruben, and I know that you were tasked with an impossible task, and I have to say that you did it perfectly. So we really appreciate this very broad and at the same time very quick overview of what the UN Human Rights System has to offer.
Thank you.
Next on our speaker list is Daniela Drandic, who will give us more of the how-to and specifically focus on a recent visit by the UN Special Rapporteur for the Right to Health. Daniela is from Croatia and represents RODA-Parents in Action. Daniela, over to you.
Great, thank you. It's wonderful to be with you today. And I'm going to complement and build on what Ruben spoke about in the previous presentation to give you an overview of our experience using UN human rights mechanisms. What I'd like to reiterate at the beginning, especially for those of you that are listening that are advocates, that are grassroots, that are on the ground, and that don't have experience and that don't have experience in using these mechanisms, and who, you know, have this kind of idea that if you're not a human rights lawyer, you can't use them. When I first heard about CEDAW 4 years ago, it seemed very daunting and very scary. But through networking and finding the right partners, we were able to create a great report, and I'll talk to you more about that as we go further on. Can you change the slide for me, please? RODA-Parents in Action is Croatia's largest parents advocacy group. We have been active since 2001 in advocating for different changes in maternity care, in everything that has to do with parenting and children. And since the very beginning, we've been advocating for respectful maternity care. We're also active in advocating for medically assisted fertility, breastfeeding promotion and education, children and parents' rights, and positive parenting. I'm mentioning this to you because it's going to be important in the next, when I discuss where we have done all our reporting. Next slide, please. So why did we decide to use an international mechanism? Well, the first mechanism that we participated in was shadow reporting for the report on the Committee to the Rights of the Child in 2014. And in doing this, we were essentially invited by other groups that we work with. When it came to CEDAW, we had been invited by feminist groups for the last session, but we really weren't ready for it. We really weren't sure what was required of us, and we felt that the scene wasn't really set for discussing respectful maternity care at that point. The situation was quite changed in 2015 when we had our next reporting session, and where we participated in preparing a shadow report. And like I said earlier, it's really not as hard as it seems when you have help of somebody, that's more experienced, that knows how to format things. And it's really important to know that the information that you have as an advocate on the ground is something that is valuable and is something that people want to include in their reports. Respectful maternity care has been included in reports. I know for the European Union, it's been included in reports, CEDAW reports for Slovakia, Ireland, Croatia, Spain, I believe, is also a country where it's been included. So these are issues that are starting to come out to the forefront. And the more we mention them, the more they're going to be put on the agenda. Next slide, please. So what did we do? Essentially, we did what we were already doing. We collected data on women's experiences. Once we had the data, we collected it into a survey. So we sent out a survey that we did online, collected the data, and we took that and made a report out of it. In order to fulfill the report and put in fill up some of the gaps that we had left from our survey, we used official statistics reports. And the wonderful thing about spending, you know, a month or two as a volunteer in our case, sitting and going through these statistics is you essentially become an expert in them. And in a small country like Croatia, nobody had been doing that. So we had the expertise that nobody else had, and that was something that showed to be very important. Another thing that we had once we had gone through these two mechanisms, these two sources of data, is that we could identify where there was data missing and we needed it. And that's as important as having data. So reporting on bad data is one thing, but not having data kind of paints the picture that you don't have a problem. And we want to always make sure, especially in areas like respectful maternity care that are just on the cusp of being put on the agenda in many countries, that not having data does not mean that we don't have problems. And we have to talk about that. Next slide, please. This was the survey that we prepared on maternity practices in Croatia. You can Google it. It's available online. It was a 5-page survey. At the end, we had 10 recommendations. And like I discussed before, these are the different things that we identified in it. This formed the basis for preparing our CEDAW report. But on the other hand, this was doing the report on maternity practices was something that was part of our kind of regular work. And then all we did later on was just utilize it in our CEDAW reporting and in other reporting we did later on. Next slide, please. As I reiterated earlier, it's very important to work with other organizations. In our case, we had the knowledge of what was going on the ground, and we had put that into the form of a report. We knew what statistics we had, what statistics we didn't have. We had stories from mothers, but we didn't know how to put all that together into something that we could submit to a UN body. So what we did was we got together with feminist organizations and networks. We discussed possibilities with healthcare coalitions, and we reached out to the Center for Reproductive Rights, which in Europe is based in Geneva, and they were hands down the best and most immense help that we had in the whole process. The Center for Reproductive Rights, I'd like to call them our reporting doula. They essentially held our hand and took us through the whole process, changed some of the language, cleaned up the format, and essentially in the end we had a professional-looking, effective report that was easy to present to the body. Next slide, please. In order to prepare the submission, what we did was we opened a similar submission from a country that was in a similar kind of situation that we were. In our case, we opened up the report for Slovakia because it was recent and because many of the issues that were going on were similar to ours. That said, looking at their report was very daunting at first. We read it a few times, went over it, identified commonalities, and then we took that and started writing our own report on that framework. Once we had that part done, we asked another organization to take a look at what we'd done to see where we could improve it, make the language a little bit better, make the format more understandable, and where we could correct it. What was important when we were doing our submission is we worked together with another organization in Croatia called the Center for Education. I can't translate it now offhand. The short form is CESI. And they handled the areas of sexual education, access to reproductive care, and abortion services, and we did the maternity services and fertility care and other areas as we agreed upon. So in that way we had a complete report with two groups who had varying expertise. The hardest part at the end was taking our baby and sending it forward. We were scared, but we knew that it was better to send something than to send nothing. Next slide, please. So as you can see, our logos are, all three logos are at the top of the shadow report that we prepared. We held it, we kept it within the, the framework that we were given, 10 pages, lots of footnotes, lots of information on where we got the different statistics, and essentially, I apologize, and we had the benefit that there were some members of CESI in Geneva when the report to present the report. So that added an additional dimension because we had a person who was physically there who could discuss what was in the report. In that way, we kind of, we used the resources that each organization had. So we had some resources, CESI had other resources, and we complemented each other. Next slide, please. Lots of information on presenting the submission is available online. The people the committee members don't have a lot of time. They have a lot of documents to go through, and it's very important that somebody be in Geneva when the presentations are being made, if it is at all possible. It helps reiterate the statements that you make in the actual report. Next page, next slide, please. We were a little bit astounded and extremely happy when we got the concluding observations for Croatia, because they had essentially taken almost, I can actually say everything that we wrote about issues and gaps in maternity care and on respectful maternity care, and they included it in their report. What is important about this is these are now issues that they are hearing for the second, third, fourth, fifth time. The committee is becoming sensitized to these issues, and these are issues that are going to be more easily explained to them because they already know what's going on. So they've heard it already from a number of countries, and when you come and you say, well, this is an issue in this country too, they don't say, what is that? They say, oh, yes, we've heard of that in other countries. In this way, we're making a very good base of soft law and documents that we can refer to when doing other work, and in a sense have, a backup for what we're saying when we're trying to advocate for improvement. Next slide, please. In December of last year, the Special Rapporteur on the Right to Health visited Croatia for the first time. And this was an amazing opportunity to present essentially the same ideas, but in a little bit of a wider scope. So we were discussing respectful maternity care, but also access to reproductive health care. We were discussing issues based with children, based on the needs of children, which is another area that we work in. So I went into that meeting with a number of pages to discuss. I kept myself within the time limit. And again, we were very happy when the concluding remarks came out. Unfortunately, as you can see them here, they're not final yet. They still have to be presented in July. But they did cause quite a shakeup in the Croatian government. They didn't cause a change. Nothing came and nobody said, yes, everything is going to be better now. We're going to change all our laws and our practices. But we are putting our government on a road that they will not be able to stray from very easily. With this basis of international recommendations and the fact that they have to report back, especially when we're talking about CEDAW and the Committee for the Rights of the Child in 5 years, these are things that we're keeping the issues in their forefront. So for example, something that's come out of this is the Ministry of Health has created a working group for the Mother-Friendly Hospital Initiative, which RODA has a member on. So it's little things, but we're definitely moving in the right direction. Next slide, please. When it came to the Committee on the Rights of the Child, this was our first report, and we were only invited by another organization to kind of submit. What we ended up submitting and what they ended up putting in the final report was information on breastfeeding and the fact that women weren't getting information or support that they needed in maternity hospitals. So it's very good that it ended up being in the report, even though it's not directly linked to the classic idea, I guess, of respectful maternity care. It's a very important piece of that puzzle. So even if your country is being reviewed by the Committee on the Rights of the Child, there's always something that you could possibly add to that, especially when it comes to breastfeeding promotion and protection. In this case, if it's not your specialty, as it wasn't in our case in 2014, it's very helpful to find another organization or organizations that are preparing a report. Next slide, please. This is an interesting mechanism that we use that's not a UN mechanism, but it's a European mechanism. I personally, that's me, DD, Croatia national, sent a petition to the European Parliament. I sent it, I don't even remember the exact year, but it took 2 or 3 years for them to even get back to us to give us a status on it. And essentially, they didn't really do anything with this petition. The reason that we sent the petition on provisions for qualifications for midwives. So I alleged that I didn't have access to midwifery care. The reason that we sent it was because colleagues in Hungary had done the same thing. So we sent this out. The results weren't that great, but it was another opportunity for our government to get at least a slap on the wrist, if nothing else. Next slide, please. What did end up happening that was very interesting was that the Commissioner for Human Rights of the Council of Europe ended up quoting that, in addition to the other mechanisms that have mentioned respectful maternity care, in a comment on sexual and reproductive health rights. So I've highlighted it here in blue, and this is something that you should feel free to use and to quote. It's available on their website. The link is up at the top. You can see it. We're essentially putting this issue on the table in a lot of countries for the first time. So it's very important to do this in as many number of ways as possible. Tomorrow, in 2 years, in 3 years, when somebody goes to a court of human rights or a tribunal or submits something to another human rights mechanism, they will have things to quote based on all the work we've done up until then. So it's very important to spend the time, and it's definitely worth it. Even though it doesn't make a big difference in the short term in your own country and in your own framework, it does make a difference in the long run. So definitely I would recommend using these mechanisms. If you're a little bit scared and don't know how to use them, find somebody that can help you. Reach out to the Center for Reproductive Rights, reach out to the White Ribbon Alliance, see who you can team up with, and take the time to do it. It really, really is worth it. Next slide, please. That was my last one was just a picture of it being the end. So thank you for your time. And if you have any questions, my Twitter handle is available from the White Ribbon Alliance.
Thank you so much, Daniela. And as you can see, organizations are not engaging in just one mechanism or type of mechanism, or even, just staying within the UN system, but really utilizing every possible avenue to advocate for respectful maternity care. So I think this is a really important thing to highlight, and I hope we have an opportunity to discuss this at the end of the presentations. Next, we have Noor, NakibuukaMusisi from the Center for Health, Human Rights and Development, who tell us more about their experience with the Covenant on Economic, Social and Cultural Rights.
Thank you. Just to give a brief background about CEHURD, or in CEHURD is a short of Center for Health, Human Rights and Development. We are a research and advocacy organization, and our role is to use the legal tools or laws in the country as principal tools for the realization of the right to health in East Africa. We envision a society where social justice in health systems is realized, and our mission basically to work towards an effective, equitable, people-centered public health system that ensures the full realization of the right to health and promotes respect for human rights. We work within specific programs of strategic litigation, and strategic litigation not just to do the litigation but also to look out for cases that we can amicably settle out of court. We also do community empowerment, and as the word sounds, empower communities to be able to demand for their rights, especially in the health system. But then human rights documentation and advocacy, a program that does advocacy at the national level, but also bridges the gap between community and then the national level work that happens. At the end of the day, what we see are human rights and health realized in the country. Next slide. So we want to share, hello? Next slide, please. Okay, we want to share our experience with the International Convention on Economic, Social and Cultural Rights and what alternative and shadow reporting means. Basically, each of the countries that signs or ratifies an international instrument is mandated to report back to that selected committee on how far it has gone in terms of implementing that particular convention. So in this sense, Uganda ratified the International Convention on Economic, Social and Cultural Rights many years back. And in 2015, Uganda was up for review. So what happens is that we sit back and look through what Uganda has done in terms of implementing the convention and report back to the Committee on Economic, Social and Cultural Rights. So what did we do, and why did we engage in reporting back? This time we did not do alternative reporting because the state actually reported, but we did shadow reporting. So why we engaged in this reporting is because, one, when you look at our constitution, we do not have the right to health in the constitution as a country. Our constitution is in two parts. It has the substantive parts of the constitution where all the rights are actually placed in a chapter, but you also have the part of the national objectives and directive principles of state policy, where you cannot hold the government to account. So the right to health in Uganda is only in the national objectives and directives principles of state policy. So to us, we thought that reporting back to the Committee on Economic, Social and Cultural Rights on the status of our own constitution and what it speaks to the right to health was one thing that would push the state to actually come up and probably review the constitution and have it included in the have the right to health included. And why we did this is because our constitution is reviewed every after 10 years. So in 2015, the time of reporting was actually the time of reviewing the constitution. So we thought we would use this time to actually place the government to have a recommendation on reviewing the constitution to include the right to health. The other thing is we thought it was time for us to take action because the state had shown that it's willing to report. It was time for us as civil society to wake up and show the state that it really needs to take action to ensure that the right to health is realized. The third thing, we thought that if in any case, I'll just give 2 or 3 examples of this and why this webinar is very important for us. We have a case against one of the Attorney General is a representative of the government in the country. So we have a case on maternal deaths that happen in the country. We have 2 specific cases of that. One was a lady very far away from Kampala that people from Uganda know, Noor, who actually died in maternity while delivering on a 10th December, a Human Rights Day. And we thought that the reason she died, or after the reports, is because the health workers were in there but were not willing to work on her because she was a person coming from opposition. Then the other case looks at a person, a lady who died in one of the other districts that people from Uganda know, Mitiana. The lady delivered twins, and actually she had prepared for only 1 child. So at the time of delivery, she realized that they realized that she got an obstruction and she needed to be rushed from a health center 3 to a health center 4. So the movement from a health center 3, which is almost 4 or 5 kilometers away from a health center 4, necessitated an ambulance, which was not there, necessitated a health worker, which health worker was 1 in a health center 3. So it's only a good Samaritan that came in with the car and took this lady to another health center 4. On reaching there, the health service provider had been questioned on the whereabouts of the drugs a day before. So this lady befell a prey to actually now this minister person who was coming from the same village where she was coming. So they had to question her, where do you come from? The moment she mentioned the village, she was told to go back to now the minister to actually have her operated upon. Remember, she's an emergency case and needs an urgent operation on her. So it became a toss between who has to call the service provider to give a cesarean. Is it the patient or it's the health facility? What the health facility did, it actually requested for money from this lady to call the health worker on duty. So to cut the story short, we asked ourselves, whose role and mandate is it to ensure that women do not die while delivering? Whose role is it to ensure that women who are out in the villages can actually come or have the passion to deliver from health facilities? And when we instituted this case, we actually instituted it in the Constitutional Court and specifically requested that the Constitutional Court gives an interpretation of the Constitution. One of the things we wanted to do is to find out if we actually have the right to health in the Constitution, since it's only in national objectives and directive principles of state policy. So it was also time for us to actually quote the different international covenants, including General Comment 14, that is on right to health, General Comment 14 of the International Covenant on Economic, Social and Cultural Rights. So we thought we would use these international and regional instruments to hold the government accountable to its rights. So the state came up and said issues to do with maternity care are not government issues, they're not issues of the judiciary, but issues of the executive. And we thought actually that the courts where we filed the case had the mandate to interpret the Constitution. As we speak now, that doctrine of separation of powers has been scrolled off our laws. At least the Supreme Court has stood with us to say it's actually court's mandate and it didn't have any issue of separation of powers. And we are back to Constitutional Court to have the case heard. The other case I want to share is a case that I think set precedent on emergency obstetric care as a right in Uganda. Almost similar cases, but this particular lady was in hospital on time, diagnosis made, and they realized she cannot deliver on time. This time round, not against the government, the Attorney General, but against the district local government, because it has mandates to supervise health facilities. So when the mother died, the doctor on duty did not, while filling, we have a maternity death form that we submit and fill in and take to the ministry. He didn't fill in the time of death. And because that failed, I think it's the only evidence that we had almost to hold him accountable that was not in hospital. While we had other nurses speak about this, the case just pulls out the issue of emergency obstetric care as a right, which I think is very important for us, and probably I can share this after the webinar such that the team reads this. Then the other case still, while we speak about respective maternity care, we feel that issues that make women run away from health facilities should all be tackled. We have cases of health facilities that we have instituted where women go to deliver in these health facilities and never return with either the dead bodies of the children or the babies that have delivered themselves. So we have sued one of the, actually the only regional referral, the only national referral hospital we have. We have two, one is on mental health, but the general national referral hospital. And why we are suing them is because they have failed to understand that respective maternity care looks at the woman herself, but also the system. So we sued this particular hospital, and we have won the case. At least the couple has been awarded very little money, but at least there are very progressive recommendations on what the state should do to ensure that respective maternity care is respected in the country. So the couple that delivered twins and was given one child represented the many women that deliver in these particular health facilities, not one, not two, and live with no child. Then I'll just leave the cases like that because we have quite many. The other thing that I wanted to speak to is the CSO mandate. We know that when it comes to reporting, alternative and shadow reporting, we have mandates. And to us, it was a push factor for us to say, let's engage and report back as one of our mandates. Then also an issue of holding the government accountable. The other thing I want to speak to is whether we work with a coalition. And yes, we lead the health cluster of the Coalition on Economic, Social and Cultural Rights. And you realize that in coalitions, people have different expertise in different fields in health. As an organization, we could not write this report alone because we don't have expertise in everything. So we thought we'd bring organizations together and have a merged report with very specific recommendations on sexual reproductive health and rights, on reproductive maternity care, but also looking at recommendations that came from the previous reporting of Uganda to see how far the state has gone in terms of implementing the recommendations. So at least, kindly, another slide. In terms of attendance, I think we really feel that the coalition did something great in terms of actual attendance. Submission, how did it look like? The submission referred to the government report because it was a shadow report. It looked at what the government had previously reported and the recommendations that came out, as well as adding in issues that we thought were very specific and not reported about the other time, but very key this time. And I think one of the issues we introduced in this report was an issue of access to safe and legal abortion as presented in our laws, because we know that the maternal deaths that occur in the country, 26% of them are as a result of unsafe abortions. So these are some of the key issues we introduced in the report. Then the submission was very referenced with work that we have done as civil society, but also the government reports, because at that time, the government was reporting 338 deaths out of 100,000 live births. So there's no way you could run away from referencing that from a government report, that actually the number of women that die in Uganda is too high, and that time would not actually meet the target for the MDGs, and indeed we didn't meet that. Then we had specific recommendations. I've already spoken about that. I also want to speak on the time that it took us. And I should tell you that writing a shadow report sincerely takes time. It needs building capacities of civil society on what it means for the government to present a report, what it means for the government to actually write back, what it means for civil society to engage in alternative or shadow reporting. So we had a lot of time building capacities of civil society on what this really entailed. We had time to agree because we had a number of meetings. We had to have a team agreement on what do we then write about, what do we include in the report, what recommendations do we need, what time do we need to write, and then having an organization like CEHURD, getting all the so many reports from over 30 civil society organizations and merging all these specific reports and following up on ensuring that the recommendations or the writing recommendations by the UN are followed. So in total, it took us 2 months to have this report written. Next slide, please. What was the outcome of this? If we have already looked at the recommendations, at least we have very good UN recommendations, sexual reproductive health and rights, on maternity care, good recommendations on, for instance, insurance. As we speak today, certificate of financial implication of the health insurance, the recommendation from this. So we feel like, yes, the state reports, but it is also coming up to accept some of the recommendations that are coming up and doing some work. How have we been able to use the outcomes of this? We have had versions, print versions, simpler versions of the recommendations, because at times we feel these things remain online and little people get to access the same and utilize them. We have also had talk shows on the same, just to raise awareness, but also let people know that we need to engage in these reportings if we have to hold the government accountable to this. We have had trainings on human rights-based approaches, and this is specifically because in the previous reporting, we had recommendations where the state was asked to use a human rights-based approach, and then the human rights-based approach guide to implement policies and programs to reduce preventable maternal mortality and morbidity. So we thought that we would utilize this time, work with the ministry and come up with we call it a gender and human rights training manual for health professionals, and it's intended to train on how to utilize human rights-based approaches in provision of services. Then we have also had meetings in which we have gone ahead to explain what the recommendations are and about and how they can be used. What would be the best practices of lessons that we have learned? One thing we have learned is that information access is very key, and there's a lot of information gap within even us, civil society, on how to use some of these platforms. Then we have also known that it is a shame to our country. So at times you really want to show the world that, yes, we are here, we are a country, but we don't even have the right to health in the Constitution. So it becomes a shame to us, it becomes a shame to the state to have some of these things. So one of the best practices is us to flag the Constitution and say we don't have a right to health. So it was really easy for us to go and engage government during the constitutional review processes and then tell them what we want to see engaged in the Constitution. So when the state does not come up to actually consider that, to us we feel it's a best practice, it's a lesson for us to shame our country and say, look, here we are, we know we shall take baby steps, but we shall get there. Then the other thing is, I think we have really utilized this or the lesson to hold the government accountable to its obligations. We know it has obligations to respect us, it has obligations to protect us, it also has obligations to fulfill us. We have a very good constitution that looks at women. Article 33 asks the state to actually consider women, and it reads, given their natural maternal functional role they play in society. So utilizing this process and reading out what is in the Constitution to us is key to hold the government accountable to even the national laws that we have as a country. Thank you so much. I think that's all I had to say.
Thank you so much, Noor, and thank you again for underscoring the importance of working with others, and as you went one step further, even training and engaging other civil society organizations who maybe didn't have the information or the tools, but really engaging them in this process. So you submitted a very comprehensive then report. Next, our fourth speaker is María Moreno de los Ríos from Ecuador, and she will speak to their experience with the Convention on Elimination of All Forms of Discrimination Against Women. Welcome, María.
Thanks very much, Elena. Good morning. During the first few minutes, I will tell you how we are working in the mechanisms for citizen participation in the UN human rights system regarding respectful maternity care in Spain and in Ecuador. Next, please. El Parto es Nuestro is a non-profit association of 900 users and health professionals. It was born in Spain 15 years ago as a result of a virtual forum to support women with traumatic deliveries and cesarean called Apoyo Cesáreas. It's still active today and through which thousands of women, mainly Spanish and Latin American, have gotten support. In 2012, with two friends, we started El Parto es Nuestro in Ecuador. Today we are 24 women. In 2015, the association was open in Argentina. With our volunteer work, we seek to improve care for mothers, companions, and newborns in pregnancy, delivery, and postpartum. Next, please. I'm taking my time with the chronometer, sorry for that. We are working to point out gynecobstetric violence as a form of gender violence against girls, adolescents, and pregnant women. Obstetric violence is a clear aggression to their sexual and reproductive rights. In the same way, we seek to recognize this violence as an aggression to the human rights of newborns that usually are forgotten. This is a new issue in Ecuador, positioned mainly thanks to Parto Nuestro. We have been working not only with women's organizations and professionals, but also with government, the Ministry of Health, and parliamentarians, among others. Therefore, we are doing a job sort of from the bottom up, but also from top to bottom. And this is where we saw the opportunity to work within the United Nations human rights system. And how do we do it? As they said before, by making what is known as the shadow reports. In short, with the shadow reports, civil society has a key tool to monitor states and denounce or demand compliance with international treaties, transparency of information, and accountability. And we wanted to be part of that. Next, please. As I said before, positioning obstetric violence in the country is a big challenge. This is why we saw the need to partnership to other social organizations that share our interests. This is why El Parto Nuestro is part of two major networks, the CEHURD, a Spanish platform made up of 50 feminist organizations, and the National Coalition of Women in Ecuador, made up of 20 organizations. In both cases, these organizations work in diverse subjects like sexual and reproductive rights, health, political participation, democracy, or education, among others. We are aware that our impact on the international level would not be possible without this networking. Alliances are therefore fundamental. In both Spain and Ecuador, we are working on two human rights protection mechanisms of particular relevance to respectful maternity care. The Convention on the Elimination of All Forms of Discrimination Against Women, the CEDAW, and the Convention on the Rights of Children. Another mechanism in which we wanted to participate, and that we want to participate in the future, is the Convention Against Torture and Other Cruel and Degrading Treatment, incorporating new issues such as the routine episiotomy, known as the Western genital mutilation, and routine separation of mother and baby after childbirth, or where the baby is admitted to intensive care without his or her mother. The reporting process are varied and can be adapted to the capacity of each organization, and this is very important. For example, in Ecuador, in order to build the report to CEDAW in 2014, we held more than 12 workshops throughout the country for 5 months, with the participation of around 650 women. On the other hand, in order to carry out the report to the Convention on the Rights of the Child, that we made last year in November, 5 organizations worked for a week with our own information. With this, what I mean is that you have multiple possibilities and it all depends up to you. The shadow reports are sent every 4 years, and the social organizations whose reports were accepted by the committee of experts can present them at the official meetings together with the states. This is not always possible because of the financial costs, as Daniela was telling us before. On the other hand, it is possible and advisable to send a half-term progress report. This means that there is almost a permanent work of information gathering and following up, not just sending the report. On the internet, you can find a lot of information on how to prepare a shadow report. In the chat, I am copying you an address that I hope you find interesting, as well as the link to our shadow report in Ecuador. I'm sending it right now. Hope you get it. Next, please. At this point, I will focus on the work that the National Coalition of Women of Ecuador carried out for the report to CEDAW. In our report, we pointed out that Ecuador occupies the first place in the Andean region and the second one in Latin America of pregnancies in adolescents. That on maternal morbidity and mortality, we did not have up-to-date statistics. That obstetric violence was an invisible and silent violence, or that health indicators are aggravated when it comes to indigenous and Afro-descendant women, gender, age, ethnicity, and poverty. After taking note of the reports submitted by the states and the civil society, the committee took note of our concerns and noticed that indigenous women and women of African descendants are disproportionately affected by poverty and high rates of maternal mortality and early pregnancies. The committee called upon Ecuador to ensure that indigenous women and women of African descent have full access to education, which is so important, and health services, and can fully participate in decision-making processes. It requested the state to include information and data, including trends over time, on the situation of these women and on the impact of measures taken to overcome the multiple discriminations against them in the next periodic report. Next, please. Okay. The committee was concerned at the high rate of pregnancy among teenagers and young women in rural areas. They recommended Ecuador to address teenage pregnancy, especially among indigenous and African descendant girls. They were also concerned at the high incidence of maternal mortality. They noted that the second leading cause of maternal mortality is abortion, and were concerned that for the magnitude of unsafe abortion in the country. That is why they recommended the Ministry of Health to undertake the issue of unsafe abortion and their impact on women's health, in particular maternal mortality, to serve as a basis for legislative and policy action. In Ecuador, both the content of the shadow report and the committee's recommendations have been very helpful for us in lobbying for the drafting of new laws, such as the Humanized Pregnancy, Childbirth and Postpartum Act, or the Organic Health Code. Also, to work with health professionals and the Ministry of Health officials. We have noticed that the information sent to the United Nations becomes more relevant to them when we say that we have sent it. As for the government's progress and compliance with the CEHURD recommendations, we can say that there are both advances and setbacks. First, the bad news. Although the committee welcomed the Free Maternity Care Act, the government a few months later withdrew the law. We don't have a new one yet. Abortion continues to be penalized in almost all cases, despite the United Nations' varied recommendations. And the National Strategy for Prevention of Adolescent Pregnancy still has a strong link with radical religious ideologies. But we are taking some good steps. At the beginning of 2017, the new National Plan for Sexual and Reproductive Health was approved. We still do not approve any law that typifies obstetric violence, but now it is specifically mentioned in various law proposals, the new Organic Health Law or the Law for the Right to a Life Free of Gender Violence, for example. The Ministry of Health has made an effort to equip delivery intercultural rooms throughout the country. However, few professionals know how to attend them properly, and traditional midwives are usually not allowed to get into hospitals. In February of this year, the ministry published the Manual of Practices and Knowledges of Traditional Midwives, a debt they had with the community of midwives for more than a decade. It should be noted that although we have data on births by ethnicity, the information is not disaggregated by age, and the one available is from 2015. Also, it is not accessible to the general public. There has been improvement in the transparency of maternal mortality data, which are now available on the web. However, the causes of these deaths are not public, and it is even difficult for the ministry staff to have access to their own information. We also know that in 2016, 39% of births were delivered by cesarean section in the country, an increasing number exceeding the 15% recommended by the World Health Organization. Next, please. Currently in Ecuador, we are preparing the midterm review of the shadow report to CEHURD. In August, we will present to the committee the report on the Convention on the Rights of the Child. We are very interested in making visible that human rights in newborn babies are affected by obstetric violence, as well as that obstetric violence is gender violence against the pregnant child and adolescents. This is the first time ever that obstetric violence is included in a Convention on the Rights of the Child shadow report. In Spain, from February to July, we will be working on the report to CEHURD. This month, the report to the Convention on the Rights of the Child we will publish and will be public. Next, please. Finally, I would like to point out some lessons learned from the process. Networking is fundamental. The committees value the reports prepared by various organizations. It is important to know the United Nations mechanisms. This webinar could be a start, and I agree with the people who was talking before that it's important to use the information that other groups have, all the knowledge they have. A generalized weakness is the lack of official statistics information and the lack of transparency of the existing data. If this is the case, it's important to mention it in the report, as they were saying before. Dissemination of committee conclusions is basic. States, although it is their obligation, don't always do it. I would like to add that the report model can be varied, as I was saying before. Select the ones that match better with your capacity. Reports from other organizations and in other countries should be reviewed. There are several websites that give guidelines for reporting. Recognizing obstetric violence against newborns and children, adolescents and pregnant women in the United Nations has been a new process that we are still exploring. It is our interest that this process will be replicated by civil society organizations from other countries. So I encourage you all to join these processes. Don't be afraid of the challenge, you can do it. My presentation ends here. I want to thank you very much. And I will leave you my mail in the chat in case you want to contact me. Thanks.
Thank you so much, María, and thank you for the encouragement. I think all of us can use it. It was really impressive also to learn of how many women themselves were engaged in contributing to this shadow reporting. This is truly impressive. We would share, I just want to point out, we would share documents as well as a copy of the slides and a copy of the presentation after the presentation is over. Or in the coming days, as well as any additional information that was submitted to us by any of the speakers. So as well as their contact information if they would so wish. With this, I would like to open the chat box for questions, and some questions have already been shared, but please feel free to type down your question as we're speaking, so it'll be addressed by the presenters. There's one question about further legal action at health facility level. Is there legal action ever taken against healthcare providers, facilities, and/or health systems? What has been the facility level impact of legal advocacy for RMC to address on access to commodities and life-saving services, referral systems, and respectful interactions between provider and clients? This is a question from Warren Arrington. I guess this refers to national legal action from the way I read the question, but Warren, feel free to correct me. And this is addressed to all presenters.
I'm sorry, I think the last question is for me. So it's what model of maternal mother-friendly care is being used, IMBCI or other? We made kind of our own, which is based on IMBCI and the FIGO guidelines, but because our obstetricians have a tendency towards FIGO, and unfortunately, for better or for worse, they're the decision makers right now, or the most powerful ones. We went with kind of hybrid. There were some issues that were brought up in IMBCI and FIGO that aren't issues in Croatia, namely some of them are circumcision and HIV infection. So those are things that we didn't include in our 10 steps, but our 10 steps are based on them. I'm going to be talking about them at the ICM conference in Toronto in June, and hopefully I'll have an English version that I can circulate to the WRA.
Thank you, Daniela, and we would welcome that as well. So I guess going back to Warren's question, I think that maybe Noor might be best placed to address that question as an attorney. She has engaged in legal action that she described in more detail during the session. But Noor, is there anything else you'd like to add in response to Warren's question? Oh, we might have lost Noor. I think she was experiencing some connectivity issues. I have a question to all presenters.
Elena, I can also...
Go ahead, Ruben.
I'm sorry. I can also... I don't know if it will address the question of Lauren exactly, but I can give an example of a situation which went all the way up to CEDAW and has actually had an effect in changing the situation back on the ground. So it concerns I don't know, some of you might be familiar with this case in Brazil called the Eileen case, and it concerns, it's an individual complaint before the Committee on the Elimination of Discrimination Against Women, and as you may recall, to reach to the level of individual complaint, you'd have to have gone through the entire national legal remedies before you can reach that stage. So the legal remedies at national level were exhausted, and the case became before the CEHURD committee. And the case concerns a 28-year-old Brazilian woman of African descent who was of a low income, who was rural, living in a rural situation, who was indigenous. She died from complications resulting from pregnancy after both the private and the public health centers denied her quality maternal health care. CEHURD, the committee, found the violations of non-discrimination as well as a failure of the state to provide proper obstetric care, and explicitly linked the victim's identity as a woman of African descent to the intersectional discrimination she faced in not receiving the care to which she was entitled. Now, in follow-up to this case, which was a case all the way back in 2011, Brazil paid compensation to the mother of Eileen, and also engaged with a number of activities and reforms, including a national action plan to address the discrimination that's obviously wasn't only the case for Eileen, but was the case for a lot of Brazilian women of African descent, especially those living in rural areas and indigenous, and those who are indigenous. So there was some definite it started off with the violation. It went all the way through the legal system to the CEHURD committee, who provided recommendations, and that fed back to an engagement with the Brazilian government, which led to particular measures being taken to address not only the individual case of Eileen, but also to address the structures and the institutions which made the violation happen in the first place. So I don't know if that answers Lauren's question, but I think that's a sort of an example of how that engagement sort of went full circle.
Thank you so much. Thank you so much, Ruben. We have another question from Rachel Robinson. How do CSOs navigate the politics of abortion in their advocacy work around RMC, particularly given that unsafe abortion is a major cause of maternal mortality? And I guess this could be a question for Daniela or María. Go ahead.
I just and I think María has a lot of interesting things to say on this topic too. So regarding the politics of abortion and advocacy work around RMC, I mean, and I totally agree with what Rachel said. So unsafe abortion is a major cause of maternal mortality. RODA is a declared pro-choice organization. That saying, we don't spend a lot of our own advocacy time and work in advocating for safe abortion. We rather team with organizations that are already doing that because their expertise is better than ours and greater. So for example, in the CEDAW submission, CESI, which is the organization we teamed up with, did that part of the CEDAW submission. We agreed with everything they said, but we just kind of divided up the area so that they did something that they had expertise in and we did something that we had expertise in.
Thank you, Daniela. María, would you like to?
We do exactly the same thing in Ecuador. We, as El Parto es Nuestro, don't have a strong position about this, but we believe that in Ecuador it's a major problem, and we have other organizations that are specifically and only working on that, almost only working on abortion and the rights to the abortion. So we accompany them and help them doing their advocacy from their own how do you say, like all the work that they've been doing for these years, and we enter more into what is gynecobstetric violence. But that's why it's so important to work in a team, no, and a pool of organizations, because each of us has their own strengths.
Yes, absolutely. Thank you, María. I have one question addressed to all presenters, and maybe Ruben can start. He touched a little bit on that. But what if your country does not participate, doesn't engage in any of these mechanisms, doesn't submit reports, which then would trigger the shadow reporting, or doesn't invite special procedures to the country? What are your choices and options then? Ruben?
Thanks for the question. Yeah, I'm here. Thanks for the question. It's a very legitimate one, because oftentimes that is something we do see also with respect to, well, I can go through each of the mechanisms, but with respect to treaty bodies, there are many cases, of course, where a state does not do the state report. But when that happens for a long time, the treaty body itself can decide to review the state without the state report and rely on the information it receives elsewhere. So the information it receives from the UN compilation report, as well as the information it receives from civil society organizations and like the participants on this webinar, as well as national human rights institutions, and it will rely on those two sources of information as well to provide recommendations to the state. So there is a situation where that has happened, and that's sort of the way the treaty bodies have sought to address that. In relation to special procedures, the first thing I would say is if you're engaging with your governments and they are claiming that there are no issues around respectful maternal care, or there's no issues around sexual and reproductive health and rights more generally, then the counter argument to that is to say, well, if that's the case, then why do you have a problem with inviting a special procedure body focusing on these issues to come visit the country? That's the first step, I would say, to pushing the state to invite a special procedure. If that doesn't work, there are other ways. As I may have shared in the presentation as well, there are other ways of engagement. You don't necessarily need to engage through the government to engage with the special procedure bodies. The special procedures you can reach out to and provide information irrespective of whether the government is keen on that being sent to the special procedure. Because oftentimes, as I mentioned with respect to communications, for example, communications by the special procedures, it's a consequence of information the special procedures receive from civil society organizations, bringing to its attention a particular issue, that's a particular case where a human rights violation is taking place, or where there's a pattern of a human rights violation taking place in the country and the state is not engaging in addressing that issue. Yeah, so that's another way of getting the special procedure to then, on the basis of that information, do a communication to the state to say, can you please address this violation, this alleged violation, or tell us what's the matter, what's the problem, and what have you been doing to resolve this issue. So there are ways to engage with that. And then the last one I would say is the Universal Periodic Review as well, which also allows many opportunities, as the slides also indicate, to provide information to engage in the national consultations, for one, with the state. So the state has to prepare a state report for the Universal Periodic Review process, and has to do it on the basis of national consultations to which it invites civil society organizations. So that's an opportunity to provide information. But even if the state doesn't wish or for some reason you're not able to participate in this national consultations, there's still the opportunity of engaging and providing information to OHCHR, to the Office of the High Commissioner for Human Rights. There's still the opportunity to provide information to embassies that are in your country from different states, which can then, at the Universal Periodic Review, put pressure on your state, so to speak. So there are still many avenues available for civil society organizations to engage, even if the state is not necessarily willing to engage. So I think that's sort of, I may have missed some things, but have a look again at the slides as well, and you'll see that there are other alternative opportunities too.
Yes, thank
I'll leave
you.
it at that.
Thank you, Ruben. And I think your last slide was very comprehensive. So when we sent the slides as well, people will have an opportunity to explore that in depth and determine then what is the best way to engage. I would like to give the opportunity to all of our speakers for any final thoughts or comments, and we're right at time.
Well, I just wanted to encourage. I just wanted to encourage you all to look at the possibilities of making your own shadow reports. I think it's so important for civil society to use all the possible mechanisms that we have to raise our voices and to let our voices be heard directly from the experts in the UN different mechanisms, and to have the opportunity to confront our main issues and our worries and our hopes with the country representatives, which usually they say that everything is perfect and marching really, really good, and it's important to raise our voices and to let us be heard. That's what I just wanted to
Thank you, Maria. Thank you, Maria. Daniela?
And can I just add one little tiny thing to Maria? We are letting our voices be heard at the UN, but also, for example, I'm speaking about these mechanisms and our reports at the Croatian Midwives Symposium in 2 days. So we're telling everybody what we did, and even though that's not it's not forcing them to make a change, it is forcing them to consider things from a different perspective and to know that what they're doing is being discussed outside of the hospital and outside of the birth room. So just that, I think, is going to contribute slowly to a shift in perceptions and a shift in the way of thinking.
Thank you, Daniela, and thank you everybody for participating in this wonderful discussion this morning. Thank you to the presenters for taking the time to prepare and to spend time with us this morning. And it really reinforces our goal within the Global RMC Council to embed RMC everywhere, so in every possible mechanism. So please take the time to review the documents that will be sent to you together with the presentation, and don't hesitate to reach out to us if you have any questions. Thank you, everybody. Goodbye.